Hepatitis B here, hepatitis B there. Nobody talks about hepatitis C well enough. In today's video, I'll be talking about hepatitis C. Hepatitis C is a viral infection that is caused by the hepatitis C virus. It is transmitted through the same way hepatitis B is transmitted. Sharing of sharp objects, receiving unscreened blood, and sometimes through sex. Direct contact with an infected person's blood also. What are the symptoms of hepatitis C? Just the same symptoms with hepatitis B because they both affect the liver if left untreated. Dark urine, fatigue, yellowing of the eye and skin, and some other symptoms depending on the person. But the sad part of it is that most people with hepatitis C virus have no symptoms for years. In fact, they lived up to decades without symptoms. The good news about hepatitis C virus is that, unlike other viral infections, hepatitis C is curable with modern antiviral drugs. Yes, the treatment is usually 8 weeks to 12 weeks. After completing your treatment, 8 weeks to 12 weeks, you go for hepatitis C RNA test using PCR. Why do you have to go for hepatitis C RNA using PCR? Why do you have to go for that? The reason is that you don't go for normal screening. The normal screening for hepatitis C test for antibody. And even after completing your treatment, if you go for normal hepatitis C screening, you will still test positive. Let me explain that. The reason is that when someone first got infected, the body tried to fight the infection by producing a protein called antibodies. The antibodies still remain in the body even after you've completed your treatment, even after the virus is no longer there. So if you go for hepatitis C screening test, you will still come out positive because you still have the antibodies inside your bloodstream. So that's why you don't go for that. You go for hepatitis C RNA test using PCR. With hepatitis C RNA test using PCR, they are testing for the virus itself inside the blood, not the antibody that your body produced when your body was trying to fight the virus. So with hepatitis C RNA using PCR, you will be undetectable. Now, let me explain something. This is not the case of HIV. Undetectable in hepatitis C means the virus is no longer there. You are being cured if the treatment is successful. And even after you discontinue your treatment, the virus will not come back unless you reinfect yourself. If you get the infection again. For those that understand the mechanism of antibodies and hepatitis C virus, they will ask, since the antibodies are still in the bloodstream, why did they not fight for subsequent infection? Let me explain. Hepatitis C virus change rapidly, very fast. For instance now, if someone gets infected and then the body produce antibody and then they got treated and no, if the person reinfects him or herself, if the person get the infection again, the antibody that the person already have in his bloodstream cannot work for the new infection because they must have changed. For instance now, a group of robbers broke into a house wearing a red shirt. The security guard remembers them because of the red shirt. The next time they return, they are wearing a black shirt. They look completely different. The security member may not remember them because they are different this time around. This is similar to how hepatitis C behaves. The antibodies that were produced during first infection may not recognize or be able to stop subsequent infection. That is why after your treatment, you need to also be careful. You need to be careful because you can reinfect yourself. So, if you test positive for hepatitis C, don't panic. The first thing you should do is you register yourself in a qualified healthcare center. See your doctor, follow your doctor advice, take your drugs, and then go back to do hepatitis C RNA test using PCR. I hope this video helps. Bye.